Well, I'm Liz Cambrone-Kapko with Beyond Type 1 and Beyond Type 2, and I'm very excited to be talking with Mary Brule. I said that right, correct?
Yes, that's correct.
Okay. So if you could tell us a little bit about yourself, where you are, how long have you had type 2 diabetes, and anything else you'd like to share?
I'm from Norman, Oklahoma, and I have been diagnosed with type 2 diabetes, I believe, for about 15 years.
Hmm.
I work as an attorney, and right now I'm working as a managing attorney in a civil litigation law firm. But I also have, for 25 years, did criminal defense, so I still do a little bit of that occasionally.
Awesome. That sounds really exciting.
I have 2 kids, all grown, no grandchildren. I'm 63 years old.
And so do you currently use insulin, or what medications do you use?
I don't. Right now, currently, I was on I cannot remember the name of it, but the new medication triapazoid, I believe it was. I'm probably misdoing it.
I think they changed the name to Mounjaro.
Correct, Mounjaro. I was on a clinical trial of that, and I went off that after about a year in about June of 2020. And then I was just on metformin still.
Okay.
Now I've quit the metformin, and about 3 or 4 months ago, we started me on a very, very low dose of Ozempic, I believe the name of it is, which is that same type of medication that's a once a week injectable.
Okay. So did you take metformin before the trial?
I did, and during the trial, yes.
Okay.
That had been the only medication I had ever been on for my type 2 diabetes.
Okay. And so how did you hear about the trial, and like what made you decide to participate?
Well, I've been struggling with weight for a long, long time. And when I first was diagnosed, I was very, very good about doing everything correct, exercising, eating, no carbs. And then as the years went by, I found myself gradually like falling off the wagon,
Yeah.
not taking care of myself as well as I should have. I then also had hip issue where I ended up having to have a hip replacement. So I was in a lot of pain for several years before that.
Mm.
And that sort of leads to you overeat to make yourself feel better, to get out of the pain, but it doesn't really work. And then with type 2 diabetes, the more you whatever, it just seems like it keeps on accentuating. The insulin resistance happens, it makes you hungrier, you eat more, you gain more weight, and it seems very difficult to break the cycle.
Yeah.
My family physician has known that I have struggled with this for quite a few years, and she has a research clinic, and she thought of me and asked me if I wanted to participate. I was very excited about it because I knew it wasn't a placebo trial. I was going to get either the Mounjaro or another type. I don't remember what it was.
Mm-hmm.
I was going to get one of those two. So it was going to help my A1C because I had started spiraling out of control. My A1C at that time was about 7.5. I had other health issues that had started. I had a fatty liver. It had lesions on it, and that was really scaring me.
Yeah.
And so between my doctor and this trial coming up, I decided it would be a good fit for me. I also knew about the side effect of weight loss.
Okay.
So I was looking for that too, because I know that controls your diabetes.
Yeah. And I just want to say, like, you're definitely not alone as far as like that vicious cycle. We're told just lose weight and, it'll get better, but it doesn't sometimes get better. And, we end up eating emotionally, and that makes it worse. And it just, you get stuck in that cycle for a long time. So I'm glad that your doctor thought of you and asked you to be in the trial. So what were your expectations going into it? Had you ever been in any clinical trials before?
A long time ago, I think I was in one for a cholesterol medication or something like that. But I ended up with a placebo. that
Okay.
did nothing. I mean, it really was. I had nothing.
Okay.
So that was not very, that was me just taking sugar pills or whatever it was.
Yeah.
So, so my expectation was actually pretty good on this because I knew that regardless of which medication I got, that 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 it was going to help my blood sugars, get them under control. And if I was lucky enough to get the Mounjaro, it would probably help me lose weight as well.
Okay. And so did they tell you upfront, like how long this is going to take, how many doctor appointments you had to go to, like what to expect that way?
Yes, yes. It was very clear that I would at least be having a doctor visit. I think it was once a month. So at the very first, I think it was more than that. I started it in around August of 2019.
Okay.
But I will mention before then, I'd had a hip replacement and I only could rehab at that point in a pool.
Mm,
So I was rehabbing in a pool, but I also in June of 2019 had started intermittent fasting. And
okay.
I continued that with my trial because I found that worked for me. So
Okay.
I'd already lost a little bit, maybe 5 pounds or so before I started the trial. And so I started that, and yes, they told me what to expect. I had one person stayed with me for the whole time that I was on this trial. And so that was my person. And we became actually very, close and talking about it. And it was very nice having that consistency. And she was just a wonderful nurse. She really was just wonderful.
It's
And
amazing. And so how long did the trial actually last? I think you mentioned you got off in 2020.
I think it was 11 months.
Okay.
So I think I started in August of 2019 and I think it was over in June of 2020.
Okay. Did you have to change anything else, like lifestyle wise?
I did. Like I said, I did naturally because I now was trying to exercise and rehab. And I knew that anything you do, you had to put some exercise with it. And so I joined Taekwondo is what I
Oh,
did. Um, and then I also began hiking on the weekends.
okay.
And as my hip healed, I could actually do that. And that's always been something I love to do, but I became unable to do it because of my hip and back pain and everything else that I had going on.
Yeah. Okay. And so has your experience with your diabetes management changed from before the trial to after the trial?
Yes. One, during the trial with this Mounjaro, I found that, well, one of the things it does is it makes you feel full and your stomach empty. And I don't have that turn off switch in my stomach naturally. But through the trial over this year, I developed that or I learned how to do that. Uh,
Okay.
During the trial, when you're on the Mounjaro, if you overeat, it's not going to be comfortable. It's
Oh,
actually going to make you upset to your stomach. It's a very uncomfortable feeling to feel that full. And so I learned to stop. And that I have kept since then. And I also have continued with my hiking and my exercising, very, very much so. Because now I'm able to physically move.
yeah.
It changed, the weight loss changed my life in the way that I can move now and what activities I can do. Because I was pretty limited until I had the hip replacement and until I lost the weight.
Are you able to share what your results were overall with
Oh,
the
sure,
trial?
sure. I lost about 60 pounds.
Wow.
Yeah,
Congratulations. That's exciting.
yeah, it is. It now since I did lose it, I've gained it back about 10 more, but I'm okay with it, and so is my doctor. My numbers are good. That seems to be the set point for my body at
Okay.
where it wants to be. Instead of being, trying to force myself at age 63 to be a lot slimmer than than I probably what my body wants to be. my body wants to be this weight and I'm comfortable with
Good.
it. There were some, one thing I like to tell everyone, because that was a really dramatic weight loss
Mhm.
in a very short period of time. I mean, really from August of 2019 till June of 2019 to lose 60 pounds, that's a
Yeah.
lot of weight. And it was fairly fast because I did lose between 5 and 10 pounds each month.
Okay.
Um, and to make it even more complicated, if you remember in March of 2020, what happened? COVID.
Yeah.
Okay, so now I was locked down at home, not in the office anymore, and isolated.
Mhm.
And what I found was when I went back to the office, how um, the psychological aspects of I looked a lot different than last people had just seen me. And I know that there was an element of people thought my body was theirs to comment about all the time.
Mm.
And it's not, but
Yeah.
I had a mismatch. My body that I was in was still my old body because I
Yeah.
had that body image issues going on. So it took me a while to catch up, I might say, to
Yeah.
feel comfortable in my skin. And so that was something that was I found I didn't know about. That's something that if I was going to say I wish I knew more about, or I had been given more support about that part of it.
Is your like provider helping you with that now?
No, because I took it on my own to
Okay.
actually seek counseling after I had lost the weight and done this, because I realized that my reaction was anger about I'm the same person that I was before I lost the weight. Why am I being treated differently?
Yeah.
Why do you think my body is up for discussion now?
Yeah.
And so I actually sought out somebody who specializes in body images and that type of issues that I have. And after doing some reading, and it's just as dramatic a weight loss that I had as if I had had some sort of surgery, stomach band or something. It was very dramatic. And so I know that for those type of procedures, you are required to have some type of counseling support on the emotional side. And
Yeah.
so that would be what I would tell people if they were doing this medicine, to make sure they have that support as well. Because that was my experience. And I bet I'm not alone.
Yeah. Well, good for you for reaching out for help. I'm really proud of you. I know that's not easy to do. And to even catch that that's something that you need help with. So that's really important that you did that.
It
And
is.
so is there anything else you would want someone who, once this drug is available to everyone, that they should consider, or that, what are your hopes for this medication for people with type 2 diabetes?
Well, people who have just struggled like I did for 20 some odd years to lose weight and think that they're never going to be able to lose weight and get this under control. I mean, for me, my reasons weren't so much what I looked like as much as it was my health, because I'm getting at that age where you read about all the bad things happen in type 2 diabetes if you're out not in control. The heart issues, the stroke issues. I already had the fatty liver issues, um, dementia. It's
Yeah.
all related to this. And so for me, this was I'm at this age that I've got to do something now. And
Mm.
so I would want anybody else to know that, it is in your grasp. Maybe you've tried the conventional way, but
Yeah.
there's no harm in needing some help from medication. And I think in the past, medications have not worked very well for people. They've been amphetamine stimulant type of things. And I don't think they've been very successful. But I also know I'm very motivated to continue to be successful, to continue to exercise, continue what I want to do. And my A1C is still Very, very good. Last time I had it checked was just about 2 weeks ago, and it was a 5.5.
That's amazing.
Well, it was 5.3 the time before. So, but that's still really,
Yeah,
really
that's still
low.
really good.
Yeah. And like I said, I'm off of metformin now, and I'm just doing the lowest dose possible of, I believe it was called Ozempic,
Mhm.
is what I'm on. And so I would have liked to have not had to have any, but I found myself starting to gain weight again and starting to lose it. And my doctor and I decided to do this as a short term to see how it went and to
Okay.
take me off of all the metformin and then see how I did with this. And they're still very closely watching my my blood. I'm getting blood checked. We're looking at levels. Um, One of the most amazing things about it was I told you my liver was just
Mhm.
totally out of whack. After about 6 months in the study, they did blood work. And my doctor said they had to send it back to the lab again to redo because they were below normal and they thought it was a mistake. So I have
Wow.
completely reversed my fatty liver. I have completely gotten my A1C under control. My cholesterol is under control now. And so all the things that I had that were bad are now seem to be in check. And so it's mostly been a health issue for me.
Mm.
And not saying that the looks hadn't mattered. I've
Yeah.
been single a long time and I actually started dating and have a boyfriend. So,
Congratulations. That's
yes,
exciting.
yes, it is. So I think I found my life partner.
Oh, that's amazing.
Yeah.
That's great. Is there anything else besides, like you mentioned, being able to hike that you feel that this has changed your life?
Energy. Beforehand, I would come home from work and I gave everything I had at the office. I didn't have anything left in the evening. So I felt like my world was getting closed in or small.
Mm.
And like I said, I don't know if that was because of the pain of my hip going out, but I can't tell you. But all I know is being out of pain and losing the weight made me have mobility, which
Yeah.
I didn't have before. And even after the hip, I still had issues with my back hurting and some flexibility issues, and the weight loss made those all go away as well. And so it just allowed me to participate more in life.
Mm.
That's the best way to describe it, is that.
That's awesome. And is there anything else that, like, if someone is debating whether or not to try this medication, I guess if you had to do it all over again, would you?
I would. I would. I recognize that I'm one of the fortunate people that I have insurance that is covering my
Mm.
medication for about $30 a month. Whereas if I did not have insurance, I could not afford this medication.
Mm.
It would be just astronomically expensive. And not only do I have insurance, I have insurance that's covering it.
Mm.
And so not everybody would have that. So I think I'm fortunate. So I would recommend it to someone, but I know that you would have to have insurance that covered it or you couldn't afford this medication.
Yeah. Yeah. And that's true with a lot of diabetes medications, unfortunately.
Well, insulin,
Yeah.
that's outrageous.
Yeah.
So
Awesome. Well, this has been really great. I'm really excited to hear all the amazing results you got. I've been able to read some of the studies, and what other people have been able to achieve with Mounjaro has been really just mind blowing that they were able to achieve these results in such a short period of time. So,
if I would tell someone who started it what I would tell them, because I was stubborn, it does cause some nausea. Okay. This
okay.
medication, especially when you're getting used to it. And I was very hesitant to take an anti nausea medication. I just was. I don't need one more pill. No, thank you. After several months, I realized, yes, I needed to take that. So take the anti nausea medication. I found out that I didn't need it on day one. I needed it day 2 and only 1 pill of it, and then I was perfectly fine.
Oh,
And so
okay.
my stubbornness is what made me have some nausea, and that's what I tell someone is don't be stubborn, just figure out when your body needs it.
Yeah.
Listen to your body is what I would tell them.
Awesome. Well, thank you so much, Mary. This was really helpful and really exciting to hear. So, is there anything else you'd like to share?
Well, I can't think of anything, but if you have any other questions, you can call me.
Great. Well, thank you so much.
Okay. Well, I hope that helps.
Definitely.